It's a disease that affects 1 in 10 female-born individuals, but one that's not frequently talked about or widely researched: endometriosis.
It's the lining of the uterus growing outside of the uterus, and the lining of the uterus is what we bleed every month. So it grows outside the uterus, for example, on your ovary, and then every month, just like you would get your period, it gets a period inside of your pelvis, and that blood inside of your pelvis and that inflammation causes scarring and can cause big ovarian cysts and fibrosis and adhesions and scar tissue that then causes pain and all the dysfunction.
The pain and dysfunction is something Arlie Cole-Doyle knows all too well.
My journey's been really long and it's still continuing. In fact, I almost feel like I'm starting over, or I should say I am starting over in terms of getting help for the disease. It took me over 20 years to be diagnosed, and when I think back to when my symptoms started, it was actually at age 9.
She says she struggled with GI symptoms, pain, and fatigue that caused her to miss out on class and activities in high school. It wasn't until after she gave birth to her son she finally figured out what was going on.
I became pregnant, and I was told that my issues during my pregnancy, my pain and discomfort, were because I was young and that it was my first time having a baby. I became very ill after I had my son, and 6 months after he was born, I was misdiagnosed with cancer. And then at that point, I went to have a radical hysterectomy for uterine and ovarian cancer, and I woke up and was told that I did not have cancer, but that I had endometriosis.
This delay in diagnosis is unfortunately common for people with endometriosis. Dr. Danielle Luciano says it's a twofold problem. People don't talk about it and assume pain with periods is normal. And she says medical providers are not asking the right questions.
So when I say to a patient, how often do you get your periods? And they say once a month. And I say, okay, and how long does it last? 5 days. I could stop there, or I could say, okay, well, but on your heaviest days, how often do you change a pad or a tampon? And when I go into that question, then I see, and then they tell me, I change one every hour. Well, that's actually not normal.
And it's important to have these conversations because symptoms of endometriosis are so wide-ranging.
The top 3 are pain with your periods, pain with intercourse, and infertility. Those are like the triad. But within the pain, there's chronic pelvic pain, so just pain in general. There's irritable bowel syndrome type symptoms, so constipation and diarrhea. There's bladder issues that can be associated, painful bladder syndrome, pain with urination. There's lots of musculoskeletal things. My patients will complain of hip pain and back pain and pain that radiates down their legs, especially during their menses. And then there's unfortunately the psychological issues that come with it. And especially when you've been in pain for a long time, or you feel like something's wrong with you, or you feel like people aren't listening to you, then comes depression and anxiety. And so there's a lot of, it becomes a systemic disease.
Now, researchers at Jackson Laboratory in Farmington are partnering with UCONN Health to help raise awareness, educate, and find out more about this disease. House Bill 6672, an act concerning endometriosis, just passed unanimously. It creates a first-of-its-kind endometriosis data and biorepository program, and it puts Connecticut at the forefront of this kind of research, spearheaded by State Representative Jillian Gilchrist and the Endometriosis Working Group.
It will be really key, and it will really be a great resource to start developing therapeutics, new drugs that we can use for a better treatment, a more efficient treatment of the disease. But also this bill is about creating awareness and education in the healthcare providers, and also we want to make sure that everyone hears about endometriosis, knows where to find the resources that they need, and contact the medical providers that will be able to help. And this is all integrated in this bill.
Researchers are hoping to set up the framework within the first year.
It's about understanding the endometrium, the endometriosis lesions. It's about understanding the different molecular mechanisms that are used for this disease to happen, to progress, or to recur.
They're looking to collect tissue, but also blood and saliva, and hoping to determine if endometriosis is a purely genetic disease or if environmental factors contribute. The goal is to not only find a way to better treat the disease, but also find a way to detect it early.
I hope that someday we have a cure for endometriosis that isn't surgery, because 60% of patients who have surgery for endometriosis will have a recurrence within 5 years, even on suppressive therapy. So then you come back again to do another surgery, and you take down the scar tissue, and then more scar tissue grows. And so I hope someday that with all the research that they're doing at JAX and with better awareness and catching this sooner, that we will find a way to treat endometriosis medically, so that we don't have to do these surgeries.
Currently, there is no cure for endometriosis. The only way to officially diagnose the disease is through surgery, and while there are lots of treatment options, nothing is one size fits all or guaranteed.
The quality of life factor on people with endometriosis is beyond what people will really ever understand unless they have it.